and privileged to formally introduce Dr. Maity. Dr. Maity is an assistant professor in the Department of English at Akui Komala. She previously served as an assistant professor in English Language and Technical Communications at Camellia Institute of Technology and Management, Boichi, West Bengal. She has recently been awarded PhD degree in comics and graphic novels from the University of Burdwan. She has authored papers which have been presented in various peer-reviewed journals. She has also presented papers in many esteemed institutes during seminars and conferences. Over to you, Dr. Maity.
Thank you so much, Shumvita, for inviting me and for giving me such a brilliant opportunity to present or to share my ideas. And I also thank Shalboni Government College for giving me such a platform. Rohan, it was brilliant. I heard the entire session was so engrossing. I was just immersed in your lecture. Okay, so yes, now I'm going to present my topic, which you all know, which is comics and healthcare awareness, use of comics as a medical narrative. Now, this particular topic, I think it's somewhat relevant to the present scenario. Okay. Previously, you all know that previously comics were just, am I visible and audible to everyone? I didn't ask this question.
Nandini,
yes,
please try without the headphone ones. I think that way the sound will come better.
Yes. Now, am I audible now?
Yes, better.
Yes, better. I think better. Go on, Nandini. Sorry for interrupting you.
Okay. It's okay. Okay, so previously you must have known that comics were only thought to be a medium or just for kids with superheroes in spandex. And as children, we have gone through the colorful pages of comics, thinking that it is only for us and not for the adults. But nowadays, it has been for quite some time that comics has been realized. It has been realized that comics are not only for children. Now, over the previous decade, this underestimated medium of sequential art form has started to get acknowledgement and praise from various artists and scholars in various literary circles. Now, comics, you all know, it's a part of popular culture, but nowadays it is seen to be gradually entering into the mainstream literature. Even you have it in your syllabuses, and mostly due to the rise of graphic novel. Now, graphic novel, I think it bridges the rift between the mainstream literature on one hand and the popular culture on the other hand. Now, though graphic novel can also be treated as comics, these both comics and graphic novel fall under the paradigm of sequential art form. But these graphic novels, apparently these graphic novels are meant specially for the adults, mostly because it encapsulates the subjective worldview of a person into which the readers are as if drawn. Let me give you one example of such graphic novel. For example, you must have known or you must have heard about Joe Sacco. Suppose I give you one example of Joe Sacco's graphic novel, or it is better known as comics journalism. Joe Sacco visits various war-torn places, war-torn countries like Palestine and Gaza. He he interviews people over there. He shares he takes a record of the experiences that the people have gone through during the war, and he writes his graphic novel like Palestine, like footnotes in Gaza, which from this you can easily understand that that the graphic novels are meant mainly for the adults, because it deals with such subjects as war, as gender issues. Most of them are very serious, and that is why they are called graphic novel. And it is mostly thought that graphic novels are meant for the adult readers only. There are some other views also regarding this. Okay. And nowadays, it is because of the rise of medical humanities movement. Now, what is medical humanities? Medical humanities is an interdisciplinary field which include both medical discourses and also humanities like psychology, like art, like sociology perhaps. So it's a combination of both, which kind of gives a holistic experiences of the condition of the patients, or what patients are trying to say. Okay, it establishes a communication between the doctors and the patients in a more what to say. It established the communication is further strengthened because of the rise of medical humanities. Now, here let me give you one example from a Hindi film, and that is Munna Bhai MBBS, because I think it is somewhat relevant in this context. You have all seen the dean, who is also a doctor, and he is trying to impart a lecture on how a patient should be treated. He is delivering this lecture to his student. Now, the body of the patient, he says that the body of the patient is just a body. We should not be sympathetic towards the condition of the patient. Rather, we should find out the problem and we should cure it. So that is the solution, or that is how he imparts his lecture, which is very formal, which is very objective, and the patients and the sickness of the patients is dealt from a scientific perspective. But Munna Bhai, on the other hand, he comes up with a different approach to deal with the patient. He sympathizes with the condition of the patients. He brings a lot of fun, and he shares the experiences of the patients. And we see that the patients are better responding to him rather than the scientific medical discourse, the scientific medical treatment. So medical humanities, so this is medical humanities. Medical humanities is the combination of both the scientific medical discourse on the one hand, and the various ways of sympathizing with the patients, of knowing the psychology of the patients, knowing the experiences, sharing the experiences of the patients. Okay, now Ian Williams is he is a doctor as well as he is a comics artist. He comes up with a new jargon, and that is graphic medicine. He also has a website. You can you can go through it. It's graphicmedicine.org. And what is graphic medicine? Graphic medicine is the intersection of comics and healthcare discourse, as comics are now found to be an apt medium to explore illness and healthcare directives from a non-scientific perspective. So that's what he is trying to do. That's what he is trying to, means he is experimenting with this new subgenre of sequential art form, that is graphic medicine, and he is experimenting with seeing how this is relevant to treat or to bring out the inner turmoil of the patients. Now, it is due to the authoritative voice of the medical practitioners over the years that gave rise to a one-sided graphic narrative that gave rise to a grand narrative, we can say, to a grand narrative of one-sided medical discourse. But often it failed to communicate or to sympathize with the unvoiced physical as well as the psychological problems of the patients. Okay, so over years, it is because of this reason that various attempts has been made to formulate and to contextualize the alternative discourse of medical history so as to emphasize on the patient's viewpoint during the ongoing treatment process. Now, with time, the graphic narrative came into existence, which proved to be a robust hermeneutic of a model design with unique and distinctive therapeutic properties, which are seen to be partially efficient to fulfill the long-awaited criteria of prioritizing the voice of the marginalized group of patients suffering from both physical as well as psychological illness, or even it deals with the sympathetic voice of the caregivers. Now, the very subgenre, as I have told you, graphic medicine, with which Ian Williams is experimenting, and many others are there who follow Ian Williams. Now, this graphic medicine can be of various types. It can encapsulate the subjective experiences of the patients. Many of the patients are there who have gone through or who is going through certain kind of diseases and who is writing or who is sharing his own experiences through such graphic narratives and in the form of a memoir, we can say. There are other graphic narratives or graphic medicines also, which are written from the point of view of the caregivers. Now, who are the caregivers who are looking after the patients day after day? They are dealing with the condition of the patients. They are seeing the ups and downs that the patients are going through. So it can be written from the point of view of caregivers. And another category of graphic medicine is also there, which deals with, or which we see is trying to create awareness related to healthcare, and is trying to spread awareness among masses, especially during such crisis moment, especially during such pandemic situation. This web comics, there are many such web comics which became very popular. Now, this talk, I'm going to, what I'm going to do is to rationalize the subjective experience of the sufferers on or their caregivers during such a pandemic outbreak through the medium of graphic pathographies, which is another name for graphic medicine, which seeks to provide an alternative discourse to the paradigm of medical history by integrating two very different fields. One is medicine and another is sequential art form, in order to foster a rather sympathetic outlook of the precarious human condition. Now, the graphic medicine, if you look at the graph, I'll show you some images, I'll show you some illustrations from some of the graphic medicines. Graphic medicines are instilled with sick, debilitated and afflicted bodies and psyches. Okay, let me show you one of the graphic medicine which has become very popular. Okay, now just see this images from graphic medicines. I have I'm explaining the one on the right side. It's taken from Mom's Cancer, and you see a woman is sitting over there who has lost all of her hair because of the chemotherapy, and she's in extreme pain because of the chemotherapy, and maybe she is going through depression, and her caregiver means who is observing her. She is writing from her perspective how she's seeing her mother suffering from such a terrible disease. And when the readers when the readers observe this picture, when the readers look at this picture, they automatically sympathize with the condition of the patients. They are automatically drawn to the suffering face of the patients, and they try to they try to means they are very sympathetic towards her condition. Okay, so it is one of the examples. There are many examples such as cancer vixen. You can go through, you can look up for graphic medicines, you can get many examples. Another such example is Maity generation, and where the author is, it is written in the form of a memoir. The author himself had experiences of Parkinson's, and he is trying to relate his own experiences through Maity generation, which is a graphic medicine. Okay. Okay. So in spite of its adolescent heritage, a comic capacitates the realistic prescription to speak to the physical as well as the psychological experiences of describing the subjective views of the disease through this particular medium of graphic narrative. So graphic narrative proves to be useful to show or to present the condition of the patients. The patients can themselves take their inside out and narrate the experiences that they have been going through, the suffering that they are feeling. It even makes easier for the doctors also to understand properly the condition of the patients. Okay. So the medium of sequential art form, it seems to be an exceptionally fit medium, communicative medium, as it graphs the interiority of the disease experience, and also develops itself as a locus of unsaid information through its interpretation and intervention of passionate facts that are full of sensitive states which are altered by illness. Now, graphic pathographies also provide as I have told you already, graphic pathographies also provide doctors with a new insight into the personal experience of illness, especially regarding the concerned patients might not mention in a clinical setting, and the misconceptions about the disease and the treatment that could affect compliance and prognosis. Now I'm coming to the present discussion, that is about the pandemic situation and how the graphic narratives are dealing with it. Now, as health organizations around the world strive to inform the public about COVID-19, about the severity of COVID-19 or coronavirus, they are trying to find best practices for mitigation, and that is why they need an instructive medium that is easy to digest, that is emotionally resonant, and of course it will be easier for the people to grasp and digest. Now, in response to the present pandemic scenario, the leading health scientists worldwide are trying to fathom some innovative measures to communicate the subtle nuances associated with novel coronavirus or COVID-19 outbreak and the global cataclysmic events that follows. Now, this juxtaposition of text and images, as you can find in sequential art forms, whether it be comics or graphic novels, may prove to be helpful in overcoming the challenge of making this pandemic information accessible to the readers of all age groups with various levels of literacy. Any people, whether he be an adult or a child, he or she will be able to grasp what is given in the comics, what is given in the form of comics or graphic novel, because there are many images which makes it easier for the native as well as the non-native speakers to understand. All the people can see the pictures, even if they don't understand the text, they can see the pictures, they can easily grasp what the graphic novel is trying to convey. Now, even the illustrations can also be utilized as iconic characters to the readers of various linguistic communities all throughout the globe to spread awareness related to this global crisis. Now, this happy synthesis of comics and medical science, COVID-19 pandemics, is a very simple and light-hearted alternative therapeutic process, and of course with no intention to trivialize the widespread global tragedy. Comics were previously known as funnies, and it was thought that comics mainly dealt with some humorous, some funny themes. But nowadays, the situation, the scenario is changing, and nowadays it can be seen that whether it be comics or graphic narratives or anything, or belonging to the sequential art group, it is trying to convey many serious things dealing with, as I have already mentioned, the graphic medicines are dealing with many severe issues, and they no longer can be called as funnies, okay, as they were previously thought of doing so. They were previously thought of giving some humorous things which is funny, which is only for children. But nowadays the thing is changing. Nowadays it is no longer, the comics are no longer restricted for the young readers only. They are meant for everyone to read. We all read graphic novels, and that is why it is there in the syllabus, because of its popularity, because of its growing popularity. Now, as the COVID-19 pandemic keeps on contaminating millions of people, it is killing thousands of people all over the globe, disassembled political, financial, and social framework, and disturb our regular day-to-day existence. In this present scenario, we have seen, or we are seeing, a flood in the innovative activities by both experts and amateurs in the field of comics and graphic narratives. There are many such people who is trying to convey the severity, or who is trying to convey the precautionary measures that are to be undertaken during such pandemic situation through the medium of graphic narrative. Now, from web journals to Instagram, superhero comics to graphic medicines, instructive comics to realistic memoirs, these comics artists are actively resorting themselves to contribute in various platforms to recount stories to meet the surging demands regarding healthcare awareness meant for the target readers of various age groups. Now, this alternative discourse of healthcare awareness, with its sympathetic approach to this pandemic crisis, tries to unite a scope of innovative work alongside practical experiences, yoked together, and provide some critical reflection with the purpose of bringing out the subjective experiences of the people who are going through this crisis, put them in writing, and market them mostly through the virtual world of internet for the readers to read in the hour of COVID-19. Now, why the comics are being published through the virtual world of internet? That can be a question which I'll discuss it later. Yes. Now, based on the philosophical construct that it is through the artistic expression and humanities that we can completely grasp the significance of the occasion and encounters. In medicinal services, art related to these healthcare factors give a holistic comprehension of the sickness experience. I have given you the example of Munna Bhai to explain this thing, that it is the combination of both the medical services or the medical discourses on the one hand, and the subjective experiences provided by art, provided by this visual culture on the other hand, which rather gives a holistic comprehension. We can understand the severity of the sickness thoroughly. We can understand the point of view of the patients. We can understand, even the doctors can understand what the patient is trying to convey. Okay, so it is a fit communicative medium for everyone. So along these lines, empowering patients and their caregivers to communicate their experiences through different imaginative methods, rather than medical practitioners who provide exclusively factual information. Healthcare humanities, what healthcare humanities is trying to do, healthcare humanities improve basic reflection and encourage the medical services to evolve beyond the limiting structure of verifiable examination and observational proof. Now, strangely, it is seen that healthcare humanities is created as a uniquely intense way to bring forth the encounters of the individuals who are going to a great extent, who are to a great extent marginalized by the narratives of clinical development. For example, the concerned caregivers, the unpaid overseers, and the different paraprofessionals. We cannot hear their voice through the medical discourses. We can hear the medical discourses from the perspective of the doctors only. Okay, so we can't hear their voices about how a nurse is feeling when he is treating or when he is looking after a patient, what a family member is going through when he or she is looking after a patient. So these things are not conveyed through medical discourses, which are written from a scientific point of view, and with an objective distance from the patients and his condition. Okay, so yes, however, arts relating to human experiences and humanities are ready to make a commitment, as for example, investigating the experiences of caregivers and the patients themselves, surveying the physical as well as the psychological needs of the patients, the medical practitioners, as well as their caregivers in certain role which is beyond the generally limited set of medical knowledge which has so far been recognized. We all know that it has so far been recognized as the normative practice in the medical field. The scientific medical knowledge is only accepted, but now the doctors, the patients, the caregivers are trying to go beyond the limited set of medical knowledge and approach the condition and approach the patients in a very different way, and approach the sickness in a very different way. Okay, yes, now one of the critics considered that comics are amazing medium for creating awareness, as I have already said, regarding the healthcare basics, and also making the COVID-19 data accessible in an easily comprehended configuration that will connect people all across the globe, because it is understood by people of all ages and of all literacies. Okay, so that is why it is well accepted, or it is well understood by people all over the globe. Now, it is not that the comics are being created recently about this COVID-19 and being circulated all over internet. It is not that. Comics were also written before. Comics were also written before about pandemic, such as the pandemics of Seattle and even the Spanish flu. Now, I'll show you some of the okay, I'll show it a little later. Okay, so there are various comics which have dealt with the previous contagious diseases, such as the pandemic in Seattle, no ordinary flu, and these comics were characterized by two basic components. Number one, they remind the readers that we are on the whole descendants of individuals who endured the several earlier pandemics which ravaged the different corners of the world. Okay, so by reading those comics, I'll show you the pictures, I'll show you the images, and you will see that the pictures in those comics are very much relevant to the present situation. So we can, as if we have read those comics, we could have been mentally prepared of what it is to go through this traumatic phase, to go through such a pandemic scenario. Okay, so first of all, it reminds the readers that this kind of thing has already happened in the past, and yes, and it also gives a bit of hope that this too shall pass, that it has happened in the past, it is over now, and now we are facing such a crisis moment, and this too shall pass. So there is a hope in this comics. Okay, and number two, by indicating different manners by which individuals can plan and safeguard their own lives as well as of others. Means these comics provide some kind of precautionary measures which are essential to be adopted during such crisis moment. Okay, so these comics make undecipherable statistical information related to the therapeutic process in a very simplistic way. Now, the juxtaposition of text and images gives a visual instance of healthcare awareness that might be easily accessible without being excessively sensational or terrifying. Those comics were not created to terrify the readers, but it was created to spread awareness for the future generation. It was created for the future generation so that when we go through these comics, we can at least be aware of the situation, not only prepare ourselves physically by stocking up food, by stocking up food and taking certain precautions like hand washing, maintaining social distance, but also we need to be psychologically prepared for this situation where we are in a lockdown phase and we can't go out of our houses, and there are many families in our neighbors also who are affected by this virus. So we need to be psychologically prepared, not only physically but also psychologically prepared for such a crisis. And this comics dealing with, or this medical narrative, or this graphic narratives dealing with such pandemics which has occurred in the past, provides us necessary information so that we can be prepared in every way. I'll show you the pictures a little later. Now, the graphic narratives written prior to COVID-19 outbreak incorporated significant data for getting prepared for this pandemic crisis, where visual instructions were laid down which are sufficient to adopt protective strategies. This blend of text and illustrations in panel sequence of the previously written pandemic graphic medicine sometimes even documented the survivors' first-hand experiences, thereby offering myriads of ways of understanding the pandemic crisis as a disruptive experience rather than merely a clinical catastrophe in need of immediate medical assistance. Even the people who are going through this phase, the people can write, or they are even writing, they are even creating some of the graphic narratives, and they are narrating their own experiences, the first-hand experiences, how they are suffering or how they are feeling in a lockdown phase, and how they are seeing perhaps someone very near and dear to them, maybe they are hospitalized or some of them even die. Okay, so these first-hand experiences are accumulated by some of the writers or even the amateurs at present, and they are accumulating these experiences, and maybe there will be some graphic narratives which will convey these experiences, and it will be useful for the future generation. Okay. So the iconoclastic nexus of sequential art form and medical knowledge makes this near-death experiences of the sufferers more visceral and real. I have shown you one of the illustrations from Mom's Cancer, and the way the patient was sitting, the way the woman was sitting, and the way she lost her hair. She is looking very upset. It proves that the sequential art form makes this near-death experiences of the sufferer. They communicate this near-death experiences of the sufferers in a more visceral and real way, and seeks to legitimize the phenomenological as well as personal aspects of such appalling experience in a rather sympathetic way. Now, I'll show you some of the images from the graphic narratives written during the previous, or written about the previous pandemics. Okay. Now see. This is a comics. It's a very small comics of 12 pages, and the name is No Ordinary Flu. It is about the Spanish flu of 1918 and 1919, which also killed thousands of people. And you can see in these illustrations, you can see how the nurses are, how the medical workers are putting on their masks, and how people are going out of business. People are staying at home, stocking food, and some of them are working from home, and deliveries are being given at the doorsteps. And a person is sneezing over here, which is a matter of severe concern. Yes, you can see this picture. You can see this image from the same graphic narrative, of course. Going out of business, the services are cancelled. The religious institutions are closed. People are staying at home cooking, perhaps, which we are all doing at present. And there are a few people in the bus, 2 people over here. One person is wearing a mask, and the other person is coughing without a mask, and that person who was wearing a mask, he is afraid and he moves away from him. Okay, so here maybe he is a government worker. He is instructing, or he is providing necessary information of what should be done. You see here, anyone sitting in public shall be arrested. Anyone shopping at a store, riding a streetcar, or out in public must wear a 6-ply gauze mask. Okay, now many kind of masks are available with 3 plies and 4 plies, I don't know what. Okay, and on this side you can see perhaps these are some medical workers or some other people also. They are traveling in a bus and they are all of them are wearing masks. Now these are not about COVID-19. It was about, this comics was written about Spanish flu. Which is the scenario was exactly similar to that of ours. And there is another, yes, there is another graphic narrative, and the name is about the American influenza epidemic, and the name is Pandemic in Seattle. Now, you see some of the images over here, such as any kind of gathering is cancelled, business and schools are disrupted, the schools are closed, there are a number of absentee workers and students as well. Now, one of the person is perhaps a delivery man. He is saying, sorry, we won't be able to make delivery. All our drivers are out sick. So this was the situation during the pandemic in Seattle, which is almost similar to the COVID-19 scenario. Now you see the health commissioner, that is Dr. J.S. McBride, he is saying that if thought necessary, every place of public assemblage in Seattle will be closed down. Here you see the dancing halls, the movie theater, the sporting events, even the religious institutions, all are cancelled. Okay, or all are shut down. And the children are staying at home. They are quarreling or they are making fun, and they are disturbing their mother. The mother is thinking that it will be a relief when the school starts again. Again, exactly the same scenario as that of the present. Okay. Okay. So you see that these comics are very much relatable to the present scenario. We are exactly going through the same thing, and this has happened before. But they are not trying to create any form of, or they are not trying to instill fear within the readers, but they are trying to convey some precautionary measures which should be adopted, and they are also trying to provide the message that this too shall pass. Okay, so yes, now I'm going to explain the comics, which is No Ordinary Flu. It is about, as I have told you, it is about the historical pandemic crisis, and it's a 12-page comic book that recounts the narrative of a child finding out about his ancestors' experience about the 1918 Spanish flu pandemic. Now, the child learns how religious institutions and cinemas were shut down, the organizations were unable to function properly, the medical practitioners and attendants were unable to provide proper treatment to a large number of sick and dilapidated populace, which is also happening now. People with different sort of ailments are going to the hospitals, but the hospitals cannot accommodate them because they are already full, because there are no extra beds available. So many people are dying in the process. So this already happened during the pandemic in Seattle, or the Spanish flu, which happened in 1918. The scenario was exactly the same situation as that of ours. Now the child around whom the story revolves figures out how little the Spanish flu laid its paw upon his family when his great uncle became its prey. So the story, along with its vivid images, which I have shown it to you, sprawling across the panels, offers necessary suggestions for respiratory and hand cleanliness, stocking up piles, working from home, getting ready for childcare, and helping one's neighbor during a pandemic, which is a situation, as I have already said, which is a situation almost similar to the current COVID-19 pandemic scenario. Now, no ordinary flu is a graphic medicine, of course, that shows a convincing storyline through the eyes of a child who was there during 1918 pandemic and interfaces with the present day danger, including essential preparatory messages. We can prepare if we have gone through this comics. Even I didn't go through before this COVID-19 outbreak. If we had gone through this comics, we would have known the situations, we could have taken precautions, we could have put on masks, we could have maintained social distance from the beginning. Okay, so it is intended to convey preliminary pandemic preliminary messages to English speaking, non-English speaking, and low proficiency communities. As I have said that the graphic narratives are for everyone. Everyone can understand. The people who are not being able to understand the text, they can at least relate with the images. They can at least see the images and understand the instructions that they are trying to convey. Okay, so created by the Public Health Seattle and King County APC, No Ordinary Flu, what it does, it graphically portrays what a pandemic may resemble. Now, what does it resemble? We have already seen, it is also there in those comics, that is void schoolyards, swarmed emergency clinics, individuals dispersed, separated from each other, maintaining social distancing. All these things are there in those comic books. Okay, so it makes the possibility of a pandemic progressively concrete by indicating that it has occurred previously, shows how people can plan, as for example, stocking of food supplies, and assist people with envisioning how regular day-to-day existence will change in a pandemic, so that they can mentally practice or they can be psychologically ready for the real pandemic situation. Okay, so as I was saying, that even we can write, even we can create some of the comics, some of the sequential art, some of the graphic narratives, which about this COVID-19 scenario, which might provide necessary instructions of how to deal with such viruses for the future generation, of course. Okay. So comics and graphic novels, as I was telling you, I already told that I'll tell you the reason later why these comics are being published or why these comics are being circulated throughout the internet. I'll explain that to you. Comics and graphic novels over a long period down the history of publishing industry dealt with tales of world-threatening cataclysmic situations and doomsday dystopias. Okay, you have seen in many comics that how a particular kind of virus is affecting several people. People are turning into zombies. Even there are some movies. Even there are some. Yes, Contagion is one of such movie. There are other movies also which deals with some, or which is about a virus, how it is contaminating millions and how people are dying in the process. And yes, so comics has been very active in presenting or dealing with such world-threatening doomsday dystopias. And at present, the comics industries across the countries are trying hard to cope with the COVID-19 crisis, not only for its own survival, but also being able in disseminating information, creating awareness among masses, sharing subjective experiences in order to attain a therapeutic as well as cathartic objective. Okay, so the graphic medicine not only performs the function of educational tool in the present scenario, but also help in enhancing the core cognitive skills like empathy, like communication, like clinical reasoning. Now, even in this pandemic era, with desolate urban spaces, the ink and paper industry, which is another name for comics industry, is trying its best to seek out various online publishing medium which facilitates social distancing necessary for the eager readers, so that the future of this industry is not jeopardized. As I was telling you that comics are being circulated all over internet because they are trying, the comics industry is now trying to channelize all the informations related to the present crisis through internet. There are reasons for it. First of all, the publishing houses are all closed, so they have to see that the future of the industry is not jeopardized, and also to retain the interest of the eager reader of comics. So they do not have to go to the shop. Of course, now the shops are also closed, and they can maintain the social distance by reading those comics online, by reading those web comics, which has been circulated by the comics industry. Okay. Now, while the comics or while the graphic medicines are meant to spread information regarding medical condition of the concerned patients, they cannot be treated merely as pedagogical comics. Now, the government of India, the Ministry of Health and Family Welfare, has given a comic book, I'll show it to you, that gives data on the episode, on the present situation, and how people can stay safe, especially the children. Okay, just a minute, I'm going to show it to you. Okay. Okay, see, this is the comics I was talking about, which is published by the Indian government. Comics, the name of this comics is Kids, Bayou and Corona. Who wins the fight? It's a comic created for COVID-19 awareness. Okay, here you can see 3 children sitting in front of the TV. They are watching TV, which shows that breaking news, the coronavirus outbreak. There is the coronavirus outbreak, and the children are having certain questions in their mind about what is corona. Okay, and here we see the father is sitting with a newspaper, also providing information about coronavirus. The curious child is going to the father to ask what is coronavirus, and the father, we see, because he has to go to office, he is reluctant to answer the question. And the 3 kids, they get together and they talk among themselves. They are trying to know what coronavirus is, and they are calling for Bayou. Now, who is Bayou? Bayou is a superhuman, a superman. Now, comics are very famous for creating superman, such as American, yes, there are Superman like Spider-Man, yes, there are several other superhuman. There are several other Superman which we see in comics, which has been published in previously. Okay, here Bayou, we see Bayou is the storyteller over here. He is a superhuman, and he is wearing a white shirt along with a blue cape, and he is instructing the kids of what they should do to defeat coronavirus. Firstly, by washing hands properly. Secondly, by maintaining social distance. Thirdly, by greeting traditionally, by joining hands, then maintaining proper distance, proper hygiene. And in this way, you see on the right, the image of coronavirus is given and how it is being destroyed by if the children, if we all can take these precautionary measures. Okay, so this was published by Indian government, which proved to be useful for the children. Even we all can show it to the kids in our houses. and they can learn some lessons about coronavirus and how to deal with it. Okay. So as I was telling you, as I was showing the illustrations, and as I was telling you that yes, this children, Vayu and Corona. Okay, the comics that was published by Indian government. It was planned by the Postgraduate Institute of Medical Education and Research and Punjab University, Chandigarh, and it has a hero named Vayu who has been called upon to instruct the children about COVID-19 pandemic so that they can battle against it. It is a 22-page online comic where Vayu is a superhuman. He is wearing, as I have shown you, he was wearing a white shirt and blue cape, and he is also the storyteller. And he doesn't simply clarify the children about the infection, he also discloses to them how one can shield themselves from it. So the story, we have already seen that the story starts with the children watching breaking news on corona infection and going to their folks, going to their parents, or trying to comprehend the severity of the situation. As the parent delays the talk, this children goes to Vayu for help. So yes, this is I think you can it is available in if you Google it, you can find it and you can show it to the small children, and it proves to be useful. The children can easily understand through the colorful pictures of what they should do to keep such a virus at bay. Okay. So there are numerous other comics about corona, about the present corona crisis, about present coronavirus crisis. Now these comics are not only meant to spread healthcare awareness, but also serve as a portal for a post-COVID-19 world trying to cope up with the aftermath of such a disastrous pandemic crisis. It not only the present web comics which are being circulated all over internet, it is not only meant for dealing with the present situation, but it also shows ways about how to deal with the aftermath of such a pandemic crisis, because we can see that many people are killed, many have lost their near and dear ones. So how to deal with the situation? Perhaps this comics will provide such kind of informations also about how to deal with the aftermath of this pandemic crisis. Now, some such comics are, the name of one such comics is Just for Kids, a comic exploring the new coronavirus. The versions are also available in various other languages such as Chinese and Spanish, I think. It is a mini comic meant for children and based on the interviews with people having experiences of the pandemic. It is it is interviewing people who perhaps some members of their families are already infected by the virus, and maybe they are sharing some experiences about the way they are handling the lockdown phase. Now all these informations are provided in this comics. Now the illustrations, which are also effectively able to communicate with not only the children but also the adults, are drawn by Malaka Gharib. She is very well known to she is a very well known what to say. She can draw very well. She has drawn, or she has suggested or how to she has drawn all these illustrations. She has made all these illustrations which are very effective for children and also for adults. Now some web comics are being published on regular basis during such troubled times, trying to infuse alertness by introducing topics such as the necessity of using masks, hand washing at regular intervals, maintaining social distancing by staying at home during this lockdown phase. Now, one such website publishing COVID-19 comics the name is Comics for Good, which is maintained by Women Cow, which is also useful for this, which also conveys some of the important messages that are related to. Now again, the comic artist Whit Taylor and Alicia 19 myth debunked. Okay, what they are trying to do through this comics is they are deflecting many misinformation and misinterpretations which are associated with COVID-19, thereby trying to lessen the panic that is being created among people mostly because of the misinformations which are circulated. Now let me show you this comic, which is I think very important because it debunks all those misinformations related to COVID-19. Okay. See here, a person is he is confused what to listen and what not to listen. You see that one person is telling that can tobacco these questions are cropping up. Can tobacco cure coronavirus? Then my cousin got it from a dog. Even I have cats at my house, at my home, and I hear that I'll get coronavirus from my cat. Okay, so yes, I read vodka as a sanitizer. It is hilarious, and yes, there are many such misinformations, and the person and many people we see many people who are confused by this misinformations, and this particular comics which I have talked about, it debunks, it deflates the myths relating to this COVID-19, and it tries to lessen the confusions that the people are going through because of this misinformations provided to them. Another such comics is Hand Washing Like a Pro. This is rather hilarious. The very title is right, Hand Washing Like a Pro. It is by Ellen Forney, who also tries to present the serious aspect of this hand washing in a rather humorous way. Perhaps she's trying to provide a kind of comic relief in this tragic situation. Okay, now yes, Dana Walrath, he is one of the comics critics, and he says that, quote, comics will have an important role in creating our post-COVID world. Okay, so there is another critic, David Lewis. He is a PhD and instructor of healthcare business and MHS program coordinator at MCPHS. He says that the world is starting to see what he has long known. Graphic medicine is a communicative medium. Yes, it is a communicative medium, and it is an incredibly effective tool for both informing and comforting. He again says, quote, quickest and most cheapest and most effective form to get out word quickly and efficiently. Now, Lewis also points out that, again I quote, it works for both high literacy and low literacy levels. So the medium of sequential art, which play an effective role in the post-COVID-19, which will play an effective role in the post-COVID-19 world, where the survivors who are in a quarantine phase or even the migrating workers, as Roman has discussed, even the migrating workers, they can relate their stories. They can relate their stories graphically. They can relate their physical turmoil. They can relate their psychological trauma and other hardships that they are going through this medium of graphic storytelling, which will prove very effective to turn their inside out and present to the world the subjective experiences of coronavirus survivors. Even we can write some of the comics or some of the graphic narratives. Even we can write something about our means of how we are going through our lockdown phase, how we are working from home. Even we can write some of the comics sharing our own experiences graphically, which will prove to be effective for the future readers. Now, the use of comics and graphic medicines is seen that the people, that the government throughout the world are using this comics and the graphic medicines to educate general population on hand washing, social distancing, and even tracking virus. So there is an app, Arogo something, I think. So it is important. It is also helpful for tracking virus. So the government of various countries are taking initiative to create various comics, various graphic narratives, so that the people in the present generation can relate their experiences means how to they can relate their experiences, or they can convey some informations about the precautionary measures through these graphic narratives. But at the same time, it is being utilized to convey feeling and offer help to individual during pandemic regularly with humor and relatability. Okay, so I hope this you can go through some of such web comics which I have mentioned. There are several other graphic medicines also which might prove to be interesting to you, because they are a rare combination of medical discourse and arts or humanities, psychology, sociology, or whatever it may be. And yes, they might prove to be very useful for the present scenario. You can take certain information from it, which will prove and it will help you to stay safe in such a situation. So that's all for today. Thank you so much.
Thank you so much, Dr. Maity, for such an interesting and illuminating session. Thank you so very much. Now this session is open for interactions and observations. I can find some questions in the chat box. I am reading them out. Okay. The first one is from Professor Onik Shamanto. He is my colleague.
Okay.
Thank you, Dr. Maity, for an illuminating insight into a less traversed field. I was wondering where and how would you place the articulation of literature in the arts and psychopathology. This should normally fall within the domain of psychoanalysis, but then psychoanalysis distinguishes and distances itself from the normalizing domain and discourse of medicine. Psychoanalysis is not medicine. The articulation, as we know, has a long history from Burton's Anatomy of Melancholy, which resonates with the plays of Ben Jonson and Shakespeare, onto the psychoanalytic engagement of Freud and Lacan with literature and the visual arts.
Okay, thank you, sir, for coming up with this question. Now, this field of graphic medicine is quite new, and it it is as I have told you, it is means Ian Williams is still experimenting with this subgenre of sequential art form, and yes, there are, as I have told you, that it is a combination of medical discourse on one hand, providing sufficient medical informations by medical practitioners, because Ian Williams is himself a doctor, and he combines it with not only with the psychology, but various other fields of humanities, like those of visual art, and perhaps sociology sometimes, and it's a combination of two. It is mainly done because as I have given you the example of that movie Munabai, it is mainly done to in order to prioritize the voice of the patients, in order to prioritize the voice of the marginalized group of patients who are unable to communicate their feelings, what they are going through during their ongoing medical treatment. So it was mainly created for them, and later this medium became available or this medium also addressed the issues of the caregivers who are looking after the patients, and also these particular medium in the later phase, this particular medium is being used as healthcare narrative, trying to create awareness. So it is a completely new thing, and still there are many kinds of experiments with it, and it's a simple and a very very sympathetic way of dealing with the patients, of dealing with the survivors, not only in the not we I have shown you that it was there during the some of the people have shared their experiences regarding the pandemic, that is that is yes, that is pandemic in Seattle, or the Spanish flu. And even now people are doing so, various people, whether they be amateurs or whether they be artists, they are doing so in order to relate their own experiences through this medium of sequential art. So yes, yes, it's a happy combination of both the medical discourse, the science, the scientific observations on one hand, and the non-scientific way of sympathizing or empathizing with the conditions of the patients on the other hand.
Okay, now, Dr. Partha Bhattacharya has posted a number of questions, 5 questions. I will be okay. Now the first one: do you think we can say that graphic medicine is an offshoot of post-alternative comics?
Of course, it can be called as an offshoot of comics. I have mentioned in the beginning of this, in the beginning of my talk, that graphic medicine is a subgenre of comics. It can be it is not a post. We cannot say post, but it can be called a subgenre, a different version of comics. Even graphic novel is a different version of comics. Graphic novel, people are now differentiating between comics and graphic novels, but yes, it means on the surface level there are some differences, but both fall under the category of sequential art. Even comics are dealing with serious topics sometimes, and even the graphic novel are dealing with some very funny incidents sometimes. So it cannot be called the word post, I think it should not be used, but it's a subgenre, a subcategory of comics. Okay, so which has been discovered, which has been experimented with by Ian Williams recently.
Okay, his second question: how does comics as a medium reflect the pain of the patient? We feel it from the bubbles. How does the medium add an extra layer?
Okay. So yes, while I have shown you the illustrations from mom's cancer, when a reader is reading about the suffering of a cancer patient, when he's seeing those images where a woman is sitting, she has lost all of her hair, she is looking depressed, even we can relate if we have someone in our family who has gone through the same situation. We will immediately relate with those pictures, with those images which are showing the same thing, because most of those graphic medicines are written in the form of memoir. So the experiences that the patients are going through and the way they are relating through this graphic medicines, the way they are graphically portraying their condition, yes, of course, the readers are drawn into it. The reader sympathizes with the condition of the patients, and the readers are the very suffering is made palpable. We can see the image of the long face. We can see the image of the head with all hair gone. So while we are seeing, while we are visualizing these images, of course, then yes, we can sympathize with the patient, and we can connect with the patient on a different level.
Okay, third question from him. Do you think that we must encourage the artists to talk more of speech bubble as an agent for the pandemic in the speech bubble?
See, both the things. Comics is basically a sequential art form. Means the text, there is the juxtaposition. It is characterized by the juxtaposition of text and image. So I think both the things are necessary. The text that are given in the bubble means the thought process of the characters present over there, as well as the images. Both of them are signifiers and both of them need to be decoded. The bubbles, yes, the text in the bubbles, they have a significance of their own, and the way the pictures, the way the illustrations are given, they have a separate identity of their own. Means they can, even if the text, even if the text is not there, even we can see those pictures and decipher the condition of the patients. Because see, as I have told you, people of all age group and all literacy level are able to understand the condition of the patients even by seeing the pictures. Even if the bubble, even if the speech bubbles are not there, even if the text is not provided by the author, even the pictures convey a message of their own. Even the pictures can stand separately. They have an individual identity.
Okay, next question from him. Any significance of the colors in No Ordinary Flu?
Yes, I can tell you that it's in blue, and there are not abundance. We are not seeing that it's a colorful comics, which we generally see. Comics are generally very colorful, but here we see just the use of one or two colors. It is done. So I'll give you one example regarding this, which is not from comics. I was going through the condition of Bengal famine, and the artwork of Chitta Prasad, and he is saying that I was studying the paintings of his, and I was seeing that prior to famine, the pictures that he drew were very colorful, and during the famine, the pictures that he is drawing are mainly mainly pencil sketches. They are devoid of colors. Why? Because the artist wanted to grasp the severity of the situation, which is not at all colorful, which is not at all jovial. It is a very tragic situation. here also we see that there are less use of colors, maybe 1 or 2 color, and it is because, and the color is almost like means if we see it, it feels like I don't know, when I go through it, means when I went through it, it felt like a hospital kind of means the scenario is almost a kind of, means as if we are in a hospital, as if we are in a situation where there are a lot of people suffering from numerous diseases. So yes, the less use of color is significant over here because because the author is trying to convey a tragic situation over here.
Okay, last question from him. Any microbiological comics in India on COVID-19?
Yes, I have shown you, I have given that example, Indian government, that Kids Bayu and coronavirus. So that is one of the comics, web comics, which has been published by the Indian government, and you can also see it online. It's by the Indian government, and it has been produced by the Punjab University, and they are they are trying to, the comics was mainly created to make the children aware regarding this comics, regarding the situation. So yes, it is published by the Indian government. There are several other I don't know, I went through this comics only. The rest I don't know whether any other comics, web comics, are published.
Thank you so much, Nandini. Any more questions? I don't think so. Okay. Thank you so much, Professor Hassan and Dr. Maity, for those wonderful and academically illuminating sessions. I also thank all the participants who graced the virtual platform. I thank my colleagues, students, and last but not the least, the patron of this web lecture series. So tomorrow we would again meet at the scheduled time, that is 11 a.m. with two esteemed resource persons, Professor Shukhendu Das and Professor Debolina Bugothaputta. Thank you so much.
Thank you. Thank you, Shomita.
Thank you.
Thank you, Shomita.